My goal is to help you all learn to surf the challenging seas of MRKH by having useful tools to stay afloat in the choppy water. I am a therapist and LCSW in private practice. Prior to talking to Laura and Meredith, I had not known about MRKH syndrome, and that is part of the problem. I want to acknowledge that I can't speak to your experience of this illness, nor can I speak as an expert in helping people cope with this. I can speak to finding a helpful therapist, how to know if therapy is effective, and how to use cognitive therapy to encourage balanced thinking. So here's the dilemma. How do you find a supportive therapist when your syndrome is not well known? My understanding from reading and watching accounts of this syndrome is that people feel isolation, they feel labeled as a problem, they feel that their genitalia and internal organs are labeled as a problem. They feel intruded upon, a loss of control of their own body, feel defined by the condition, feel alone and isolated, and have fears and emotions about infertility. Can people identify other emotions and experiences of MRKH? Has anyone had negative experiences with therapists or positive ones? What should you ask when calling a therapist for the first time and trying to figure out if they can help? What do you think? Is this person interested in hearing what this condition means to me? Do they ask questions and seem invested in understanding my experience? Has this therapist worked with individuals with struggles that have similar emotional themes? Some of the similar themes might be people that work with sexual trauma, therapists that work with intersex or transgendered individuals, therapists that work with infertility, coping with chronic syndromes, or coping with rare conditions. Another therapist that might be helpful would be a sex therapist, as they would be more comfortable talking with content about genitalia and reproductive organs. What is your experience of mental health therapists that have worked with similar themes? Many therapists in private practice will do a phone consultation or a complimentary initial session. Shop therapists. Go to several first appointments in a week or two. And be sure the therapist can talk about how they can help you. The next question is how to know if therapy helps. Overall, the research says that therapy helps. But how do you know if it's helping you? You should see less intense symptoms. You should have less frequent negative thinking, less intense negative thinking, and shorter periods of time that you're down, sad, depressed, and anxious. Fewer hopeless thoughts, less ruminating, less going mentally in circles over the same thing. Fewer debilitating fears, feelings of comfort, validation, and catharsis. And your thinking may shift from seeing MRKH as your whole life to seeing it as just a part of your life. Therapy is working if there's more calm thinking that sees MRKH as a manageable condition. Learning to surf. Cognitive therapy helps. Cognitive behavioral therapy helps people identify thoughts that are leading them to negative feelings and unproductive behaviors. These are the kinds of thoughts that sad, frustrated, or worried people have. I'll never fit in. I'll always be an outsider. I will always feel sad about this. This condition will be the focus of my life forever. I will never feel whole. What do you notice about these thoughts? Thoughts that leave us angry, hopeless, and anxious tend to be all or nothing. They predict a catastrophe or awful outcomes, and they're very sure that things are hopeless. Tell me some of the main fears, hopeless thoughts, and negative thoughts that people with this syndrome have. Even if there's some truth to the negative thinking, the thinker could be magnifying the possible negative outcomes. Here's some examples of more balanced thinking. I may have to take a lot of time to look, but eventually I will find other people that can understand my experience. I may have to look very hard, and that is frustrating, but with time and effort, I can find a doctor that has experience with MRKH. It could take a long time, but eventually I will learn to feel comfortable with my body. Acknowledging the frustrations while keeping away from all or nothing thinking that leaves one hopeless. It helps to acknowledge a potential positive turn of events. Here are some helpful cognitive therapy resources. Finding a therapist when you have MRKH must be difficult. Look for someone who seems to accurately reflect your experience and who has skills with individuals facing similar challenges. Cognitive therapy can help you get out of hopeless and worried thinking. It can help you think in a more balanced manner. And this is very important when one has a misunderstood and rare syndrome. It's going to be hard to have balanced thinking, but it is possible. I hope I've left you with more ability to stand on the board.
Great.
Cool.
Yeah.
So they're born with